So today we are going to talk about how to maximize learner assessment during oral presentations. Let's start as always with the ACGME clinician educator competencies. So today we will be reviewing ETP1, teaching and facilitating learning, ETP3, learner assessment, and ETP10, learning environment. So I want to focus on two big challenges that we have when we are assessing learners. One is that we have rotating groups of learners and they're only on service with us for a very finite period of time. On the inpatient setting, that can be 2 weeks or 4 weeks, but in the ambulatory setting, that can be half a day every 5 weeks. And of course, the biggest challenge that we all face is that we are all up against the clock. When we think about how learners develop, we often think of the RHYME framework, which you may have been taught, first described in 1999. R stands for reporter, I is interpreter, M is manager, and E is editor. So we classically think of medical students being reporters, interns being interpreters, senior residents being managers/editors. And so we want to cut to the part that we're actually trying to assess for the learner. And so if we're trying to assess someone's ability to interpret, we have to assume that they are able to report. And so there's a couple ways to do that. And so we want to quickly accelerate our learners to the highest level in the RHYME framework. And this will make rounds feel less performative. And now our attention shifts to the main priorities of rounding, which are patient care and resident education. In order to do this successfully, you will need, as the attending, you will need to review data prior to rounds. If you do not do that, then rounds can become very performative and you will need to have reporting done. Thank you. So an example of how you might do this with medical students. So some ground rules you can set up. You can ask for full presentations on the first day of service. You can then give line item feedback about use of nomenclature and presentation structure so that they understand the quote unquote correct way to do this. As each day progresses, you should consider having them consolidate reporting if you feel they have captured it. So if you feel like they are quickly able to report the vitals and accurately do that in a way that makes sense, maybe have them skip that part. You also want to strategically probe their ability to gather information. So if nausea is a component of the clinical syndrome that the patient is experiencing, and they didn't report that to you, you can always ask them, well, did the patient have nausea? Now let's talk about some ground rules that you might have for sub-interns or house staff. So one way you can do it is say, only give me the assessment plan. And you have to ensure that they do this every single day. And a nice way to frame it is, if you do not think it belongs on the acute problem list, do not present it to me. And this will actually let you assess their ability to synthesize information and interpret findings and basically prioritize them. It's really important to not interrupt the learner, as this can derail their train of thought. And you want to strategically probe lower levels of RHYME. So if you're only giving assessment and plan, you may not have them report any vitals. And so after they're done presenting, you may have seen a heart rate of 34 that wasn't mentioned. And you may say, what did you make of that heart rate of 34 that was recorded? And it's important to ask this in a non-judgmental way, because they may end up saying, well, I saw that, I talked to the nurse, and the recording was spurious, and they're going to update the heart rate because it was actually 74. And that's why I didn't bring it up to you. So you really have to come from a place of curiosity. An important point about questions that you ask, you want to avoid guess what I'm thinking type questions, and you want to ask open-ended questions. Very often we have a specific teaching point to share, but choose to engage learners through direct questioning in order to help punctuate that factoid. And that practice doesn't actually help us assess learners' medical knowledge, and it doesn't foster a psychologically safe learning environment. So, by asking open-ended questions, you can observe learners' thought process and how they progress in building on their foundational knowledge, or you might identify gaps in their knowledge, and then you can help fill those in. So in summary, you can consider assessing learners at the highest level of the RHYME framework as possible. And to make sure that they are still consistently doing lower levels, you want to strategically probe to make sure it's being done. And that's all.